Good morning. For the record, my name is Erin Murphy, at-large City Councilor, and I am the chair of the Boston City Council Committee on Strong Women, Families, and Communities. Today is March 7th, 2024. This hearing is being recorded. It is also being live streamed at boston.gov/city-council-tv and broadcast on Xfinity Channel 8, RCN Channel 82, FiOS Channel 964. Written comments may be sent to the committee email at ccc.swfc@boston.gov and will be made part of the record and available to all councilors. Public testimony will be taken at the end of the hearing. If anyone does want to sign up for public testimony, you can sign in at the door. If you're interested in testifying virtually, you can email Central Staff Liaison Megan Kavanaugh at megan.kavanaugh@boston.gov for the link, and your name will be added to the list. Okay, so today's hearing is on a few dockets. So just for clarification, we have several dockets that have come through the council, so glad you're here. Thank you for making yourself available on short notice. And so I'll read through the dockets so we can officially get them on the record, and we'll talk about them. So docket 0376 is a message in order authorizing the City of Boston to accept and expend the amount of $2,232,142 in the form of a grant for the Nutrition Service Program awarded by the U.S. Department of Health and Human Services, passed through the Mass Executive Office of Elder Affairs, and it will be administered through the Age Strong Commission. This grant funds nutrition services for older adults. Docket 0379 is a message in order authorizing the City of Boston to accept and expend the amount of $1,038,243 in the form of a grant for the federal FY24 Title III-B supportive services awarded by the U.S. Department of Health and Human Services, passed through the Mass Executive Office of Elder Affairs, and it will be administered by the Age Strong Commission. The grant will fund home-based support services for older adults in the City of Boston. I feel like Clerk Jerntis here, reading through all the dockets. Docket 0380, a message in order authorizing the City of Boston to accept and expend the amount of $530,909 in the form of a grant for the federal FY24 Title III E-Family Caregiver Support Program, which is awarded by the U.S. Department of Health and Human Services, and it's passed through the Mass Executive Office of Elder Affairs, which will be administered by our Age Strong Commission. This grant funds caregiver services for older adults in the City of Boston. Docket 0382 is a message in order authorizing the City of Boston to accept and expend the amount of $461,143 in the form of a grant for the federal FY24 Title III-A administration awarded by the U.S. Department of Health and Human Services, passed through the Mass Executive Office of Elder Affairs, to be administered by our Age Strong Commission. This grant funds the cost for administrative of Title III programs. Docket 0383 is a message in order authorizing the City of Boston to accept and expend the amount of $177,271 in the form of a grant for the federal FY24 Title III Ombudsman Program awarded by the U.S. Department of Health and Human Services, passed through the Mass Executive Office of Elder Affairs, which will be administered by the Age Strong Commission. The grant will fund consumer protection programs to improve long-term services for older adults in the City of Boston. Docket 0384 is a message in order authorizing the City of Boston to accept and expend the amount of $150,000 in the form of a grant for the Age Strong Commission for the Universal Fund, which is awarded by the donor group to be administered by the Age Strong Commission. The grant will fund senior center programs and services for older adults in Boston. And docket 0386, a message in order authorizing the City of Boston to accept and expend the amount of $84,058 in the form of a grant for the federal FY24 Title III D Disease Prevention and Health Promotion awarded by the U.S. Department of Health and Human Services, passed through the Mass Executive Office of Elder Affairs, which will be administered by the Age Strong Commission. And this grant funds services that assist older adults in Boston to prevent illness and manage chronic conditions. These matters were sponsored by the administration, and they were referred to the committee on February 28th. I am joined here today by my colleagues, Councillor Flynn from District 2, and my co-chair and former chair of this committee, Councillor Braden from District 9. So thank you for being here. And thank you, Emily and team, for being here. We'll start with opening statements, and then we'll pass it off to the panel. Just thank you. I know we met. Thank you for coming by my office. We had a meeting a couple weeks ago, and one thing that really sticks out is most of your funding and the support that we give, and you do a wonderful job supporting our older adults in the city of Boston, comes from grants. So there's a lot of people downstairs working on making sure they apply for these grants and that we get them received, awarded. So happy that we're on the last stage here, that we'll have this hearing today. We'll probably learn a lot of wonderful things you're doing. And then at the next council meeting, we'll put forth a committee report and get these passed so we can get the money back to you, because I know you're already doing amazing work. So with that, I'll pass it off to Councillor Flynn.
Thank you, Madam Chair. And before I begin, I do want to recognize Councillor Braden and her work on supporting our seniors as chair of this committee, this important committee, the last term. So it's an important committee, and I know you'll continue the work of Councillor Braden in fighting and advocating for our seniors across the city. I also wanted to recognize Commissioner Shea and your team for your professionalism, for your hard work, your decency, your caring attitude in advocating for seniors across Boston. When there's an event taking place, and I know it's run by Age Strong, I love going up and talking to the team that you have there, and they're very professional, they're very outgoing, but what I really observe them doing is engaging seniors across the city, and they have notebooks and they have pens, and they're taking down a constituent request from a senior, and they're following up with that senior. So I observe them closely, and they take their job very seriously and follow up with seniors that have a particular question on a particular issue. So, that's what our city is all about. It's dedicated, professional city employees. They're not looking for any credit. They're not looking for any pat on the back, but they go out and they do their job every day, sometimes in the weekends, but they bring out the best in people, and they support our seniors and persons with disabilities, and it's exciting. It's really exciting for me to see that attitude, and as someone that travels around the city, I closely watch our city employees, but Age Strong is very professional, and just wanted to say thank you to your team, Commissioner Shea. I don't have any further comments. Thank you, Madam Chair.
Thank you, Councillor Flynn. Councillor Braden.
Thank you, Madam Chair, and good morning, everyone. Thank you so much for being here. I just want to say how grateful we are for the great work that the Age Strong does across the city, and I know we're particularly proud of our senior centre in Brighton, the Veronica Smith Senior Centre, and the great work that happens there. As has already been mentioned, so much of your work is funded by federal grants, and we really appreciate all the great work that goes into that. It takes a lot of diligence and writing of the grants, and then reporting back on your outcomes, etc. So it's a lot of work, but it generates a lot of support for our elder seniors and residents across the city. So thank you so much. I look forward to the conversation. Thank you.
Thank you. I will just read, there's one letter of absence from Councillor Ben Weber. Dear Chair Murphy, please excuse my absence from today's Committee on Strong Women, Families, and Communities hearing on dockets 0376, 0379, 0380, 0382, 0383, 0384, and 0386. Supports for seniors is of great importance to me as the councillor representing the highest percentage of seniors in the neighborhood of West Roxbury. Please note that I support all of the grants being discussed today, especially docket 0384, which would fund senior programs and services for older adults in Boston. And I will read 3 questions he would like to be read into the record. In my absence, I ask that the following questions be read. Is there any data on seniors looking to access daycare services who aren't able to currently? What are the largest barriers to increasing participation in senior daycare programming? And will this grant be for senior programming throughout Boston or for existing centers that are run by the city? Please note that my staff will be attending the hearing and I will thoroughly review the video, hearing minutes, and public testimony for this docket. Sincerely, Ben Weber. I do, as an at-large city councilor, I always love when district councils like to stake their claim, either have the most seniors, have the most in public housing, but I do think District 6 in West Roxbury has the most seniors who live in their own homes, right? There's a lot of data, which is wonderful across the city, that helps you gauge where you put your resources. But with that said, we are ready for you to share what you'd like. Thank you.
Wonderful. Thank you so much, Councillor, Chairwoman. So happy to be here today, and Councillor Breeden and Councillor Flynn and Councillor Weber. Always happy for your partnership and support. I'm Emily Shea. I'm the H-Strong Commissioner for the city. Have the fabulous job of leading a team of 100 staff positions, and also our many partners out there in the community partners, and our older adults who really help to kind of drive the ship in Boston in terms of older adult programs across the city. I'm here today with my leadership team, Miles Garrity, who's our Senior Director of Finance and Administration, and Melissa Carlson, who's our Senior Director of Programs. We can never remember it. Oh my goodness. Programs and Partnerships. We clearly made the wrong title for Melissa because neither of us can remember it. But really, they do so much work on these grants, and so I just wanted to make sure that they were able to come today in case there's any kind of content issues that I'm unable to answer. We're excited to be here today around these grants. So really, the majority of these, except 0384, which is for our Universal Fund, are coming through. The funding for the majority of these grants comes to us because we are considered the Area Agency on Aging in Boston. That is a federal designation. And this funding goes to every area agency on aging across the entire country. So it's part of the Older Americans Act funds, and comes to us because we are the what they call the AAA. There's a bunch of responsibilities that go with that funding. So we are required every 4 years to do a needs assessment for people over 60 in Boston. We then craft something called the area plan, and we work closely with the State Executive Office of Elder Affairs. So we're giving them all of that planning information that they're then compiling into a statewide plan for older people across the state of Massachusetts. The way that we work with our funds, with our what we call Title III funds, because it's Title III of the Older Americans Act, is we keep some funds in-house. It's actually a limited amount of funds that we keep in-house. So we keep our Title IIIA funds in-house, which are our administrative funds, and we keep a small portion of our Title IIIB funds in-house, about $230,000 that we keep in-house of Title IIIB that helps to fund some of our advocacy and benefits specialists, a portion of their salaries, and also our taxi coupon manager who goes across the city and sells taxi coupons. But the majority of funding that we have, we actually put out in our RFPs and grants to our community, to partners in the community. So we go through a process where we kind of publicly procure for partners. These partners are essential to us. We think of them as making up the aging services network in Boston. And they are funded primarily through these Title III dollars. I'll just, as an aside, in the past couple of years, we've also had the opportunity through some unspent dollars in our budget to use some funding that we had for our operating budget to also put some grants out to the community through our operating budget. And you'll see we just put out some expanding engagement grants, which were funded in part through a council investment in our budget for social programming. So these federal grants that we put out that we're talking about today are cost reimbursement grants, and they're, Miles has a whole team of folks and Melissa has a whole team of folks that are really very carefully monitoring the spending of these grants, both on the finance side with the invoicing and then also on the programmatic side, so that we can make sure that when folks tell us they're going to do something and they create their scope of service for us, that they're doing that out in the community. And if they're needing some support, either to kind of meet the goals that they are laying out in their scope of service, or in their budget for us, that our team is able to provide them with the support that they need to get the job done for our older adults. So our community partners for these grants are essential for us. Chairwoman Murphy, I'm not sure what is most helpful in this case. Would you like me to kind of go through each one, or?
Well, I think I'll introduce Councilor Fitzgerald. He can say his
Perfect.
opening remarks, and I think what would probably be best is if each of us have any specific questions, and then you can speak to the questions.
Sure.
And then if they want more explanation. So I think they are pretty much self-explanatory, but I think it's important that we're getting like the overview of the services.
Great.
And obviously too, for me, it's going to be most of the funding comes through grants, but we also will be coming up on budget season. So what do you need from us going into the budget season that would be coming from our, city funds? So Councilor Fitzgerald, welcome. Thank you for being here.
No, not a problem. Thank you, Chair. In the interest of time, just want to say thank you guys for coming and allowing us to ask some questions and understand better where money's going, grants or budget and otherwise, so we can kind of put our head together as we go into budget season. But thank you for coming. Thank you, Chair.
Thank you. I'll start with one question I do have, or more maybe of an explanation. Yesterday, too, at the council hearing, there's more grants coming through about, food service. Is there, in the past, what I hear a lot about is a need for more transportation, like 2 events or more, programming for seniors when you go to individual neighborhoods. And of course, we always want more. Maybe there is enough there, but if you could speak to, I know you mentioned the taxi service, coupons, but is there talk, or have you been trying to increase the availability for, sometimes you hear from senior centers that they've been invited to an event, but then maybe there's not transportation, and maybe that's not for your department directly to be offering. Maybe we can, get it from a different department, maybe transportation or someone, but if you could speak to that, please.
Sure, I'm happy to do that. So we don't use a lot of, except the taxi coupon manager, there's not a lot of our Title III funds that go to transportation. What I will say is our city operating budget, and we really think of our, all the different funding streams that come into us kind of as a whole, right? Our city operating budget fully funds the Age Strong shuttle. So we have 21 driver positions for the H-Strong shuttle that are primarily driving people to medical appointments and some grocery shopping trips. We are working to kind of fully staff the shuttle. And then one of the things that's kind of on our goal to do with that is to try to see how we leverage any additional external funding that we could potentially leverage, potentially healthcare dollars for that, because we're doing a lot of rides to hospitals, and to see how we kind of expand the places that we're driving for our shuttle and the hours and everything like that. So we, I think that we also have a significant, we also have a good amount of our budget, and I don't know the dollar amount right now, but that pays for transportation to our events. So we have a specific amount of money that's allocated to transportation kind of for the larger events around the city that people are going to need transportation to. And we go out to bid typically for that event. So our shuttle is able to do some of that transportation, and then we also go out to bid for a transportation partner to be able to drive people.
Do you feel there's enough money in your operating budget, or do you often, are there parts of the neighborhood, because I do know when I've gone to these events, if it's, there was one recently at BU, or if you're out in West Roxbury, at the Irish Social Club, and
Yeah.
you can see the neighborhoods. It's like, oh, here's our Brighton seniors, they're here at this table, we have
Yeah.
our Keystone seniors over here.
Yeah, I think we're excited to see what comes out. Obviously, the mayor's budget isn't finalized for this year, and we always feel well supported for the city, from the city. What I would say is that our older residents are one of our fastest growing populations, and actually the BPDA has been working on some projections which we can share with council. But I think that as we look, into the future, one of the tasks that's on our plate, working in partnership with our Human Services Chief Jose Masso, is to really think about how we can leverage external partnerships to increase the amount of senior programming and support that's offered across the city for people. I think if you take anything that the city does, right, in any department, where we always could do more, that's what the city is, right? We want to meet every need that our residents have. And so I think that, of course, we could do more, just as every other city department could do more. But I do think that as we look into the future, how we leverage additional external partnerships will be really important.
Thank you. Councilor Flynn?
Thank you, Madam Chair. Thank you, Commissioner Shea. Commissioner Shea, as we are coming out of the pandemic, can you talk about the impact the pandemic had on seniors and their mental health, their ability to access medical care, a medical provider, and what are we going to do in terms of ensuring our seniors get the medical care that they need and deserve?
Yeah, those are certainly good questions. The pandemic took a toll on older adults. I think probably one of the most impacted communities with the pandemic. A lot of our older residents passed away, and people saw friends and families dying, and that's obvious. And they were also stuck in their homes, right? And maybe weren't able to get the level of support or engagement that they needed. So it certainly had a huge impact on older adults. We were really grateful last year, so not this year, but last year, in the FY24 budget. Are we in 25 now? No, we're doing FY23 budget. we're really grateful to get a $600,000 investment in elder behavioral health, which was just huge. So we now have a team downstairs that is a team of 2 that are clinical social workers. They're helping to support our the folks that are coming into our office that are seeking assistance with other things like housing support, or maybe they're having trouble paying all their bills, but they're really presenting, it's hard to help with those other things unless we can do more intervention kind of around their mental health and wellness. And so they're working on those things. They're also providing training to the rest of our team to see how we can work better with people that are living with mental health issues. In addition, we were able to put about $360,000 out into the community, into grants. So we're funding Whittier Street and Harvard Street health centers to do additional work with older adults who need behavioral health supports. We're funding a Spanish-speaking clinician for the Ethos MHOT, the Elder Mental Health Outreach Team that sits at Ethos. We're funding kind of peer support behavioral health model and community health worker behavioral health model, and some additional behavioral health support for Greater Boston Legal Services. So a lot of great things we're getting out there into the community in terms of funding. We also are partnering with a group, with a consultant that's helping us to understand the behavioral health landscape for older adults in Boston and what role the Age Strong Commission in the city can play in that landscape. And so, so we're working on that. But in addition to the behavioral health work, I think the isolation and the need for connection has been huge. We just had out our expanding engagement grants, which this is now the 3rd year that we've been able to do those grants. And we are just starting to read those grants that came in, but I know we got over 60 grant submissions for that. This is money that we're getting out into the community that's really about how we're connecting people together, and how we're breaking down social isolation. And so I think that that is a big thing from the pandemic as well. We're seeing increased interest in the events that we have. We just had a Black History Month event a couple of weeks ago, and we had over 600 people come to that. We actually had to start putting people on a waiting list because the space wasn't big enough to hold the amount of people that wanted to come. We also are seeing increased interest in our senior centers in East Boston and Brighton, and in our programs that we're running across the city. So we are excited to right now be working with a consultant who's helping us helping us in human services and libraries and BCYF kind of think about senior programming and engagement across the city in the future, and what we need to do to create more opportunities for folks to come together.
Excellent. Thank you for the response. And I guess I'll ask one final question. And thank you, Commissioner Shea. Can you talk about, and this is an issue we've talked about and worked on in the past, and I know your office is working on this issue, but people taking advantage of seniors through various scams, calling them on the telephone, asking them to send money to a relative that might be in jail, might be hurt, might be in a hospital, might be hurt on vacation. And what are you seeing on that? And what are we doing in terms of a public education campaign to inform seniors that most of the time these calls are a scam, and that there's steps to take to prevent from being a victim of this type of a scam?
Yeah, so such an important topic, and actually on March 19th, there's going to be a convening a conference around elder scams that's being held, the Pension Action Center at UMass Boston is going to be hosting it. And I'm going to be on a panel there speaking about these topics. And hopefully we're actually going to be transporting about 60 older adults there to be a part of this. But there's going to be a lot of the folks that are going to be there are folks that work with older adults. But super important topic, and we work really closely with the Boston Police Department on it. Their community service officers can come out to senior groups and kind of talk about how to prevent scams and what to do if you feel like you're getting scammed. In addition, we, as part of our AmeriCorps Seniors programs, we run the AmeriCorps Senior RSVP program, and we have a team of volunteers in that program that are dedicated to a program called Money Smarts for older adults. So they're trained to teach this program that was developed by the FTC and the Consumer Protection Bureau. I said that wrong, but it was developed by federal agencies to, it's an evidence-based program to teach older adults about how to avoid scams and protect their finances. And so we have a team of older volunteers that are out there teaching this throughout the neighborhoods. In addition, we take every chance that we can to highlight scams in our seniority magazine. We print 15,000 copies of Seniority Magazine that go out through the neighborhoods. You can get them at over 300 drop-off locations throughout the neighborhoods. We have an online following, and we're starting now to translate pieces of Seniority Magazine into Spanish. And it's our goal in the future to figure out how we make that and other information more accessible for kind of all older adults in Boston. So those are some of the things that we're doing around scams, but I feel like we can never do enough in this area. I think it takes all of us to really continue to message to people how they can prevent scams.
Thank you, Commissioner Shea. Madam Chair, I have no further questions.
Thank you, Councillor Flynn. Councillor Braden?
Thank you. The scams, one particular one that we hear a lot about is just the aggregated electricity, like the community choice. Like, we get solicitations every week. You get cards that offer you $200 if you sign, and the bottom line is that you're going to pay a lot more for your electricity. I know we've had hearings on this issue in the City Council over the last 4 years. I think the last one was maybe when Councillor Janey was on the council. I think she chaired a hearing. Utility bills, and we dealt with a case last week where the cost of utilities is increasing, and sometimes it's the service charge for the delivery. Like, they actually don't use that much gas per se, but the delivery charge is more than the cost of the product. So I don't know, is there any advocacy work going on in that space with regard to scams and just the utility? I just read today that utilities, National Grid's asking to put our utility costs up again, and elders, like, that's a pain point for folks if they're living on alone and trying to keep their home warm in the winter time.
Yeah, for sure. So I would say my office is not doing specific advocacy around that, but we partner really closely with ABCD and their fuel assistance program. They are critical partners for us, and in terms of helping older residents to pay for fuel and utilities, and I know that they work really closely with the utility companies. I also know our environment department works closely with the utility companies. From our end, we work with older adults around their utility bills. We try to get them onto kind of all of the programs they can get onto that the utility companies have for folks that qualify that are lower income. We try to help them get onto, there's a utility shut-off protection program for older adults that we help folks access. We also work closely with people that may have gotten their utilities shut off or may have large utility bills, to try to work with them and the utility companies to get onto payment plans that are manageable for them. So those are the different ways that we work with the utility companies.
That's very good, thank you. And then the other, in terms of the, you know, your huge part of your work is working with food access, and I know, could you tell us a little about just the ethnic foods that are available? I know you work with the Chinese Golden Age Centre, but we have a very diverse multicultural city, and those folks are aging now, so how are we doing on the ethnic foods opportunity for folks?
Yeah, that's a good point, Councillor. We do work a lot with food access. We actually, just to let folks know who are listening out there, we are a SNAP outreach partner, so we can help people apply for SNAP and work directly with DTA to get people onto SNAP, which is really important. We also help people access food kind of in all different ways. We have volunteers who help pick up food at food pantries and bring them to their homes. And I think what you're referring to, Councillor, is one of our pieces here, this Title III-C program, which funds the Elder Nutrition Program. There will be 2 other grants coming through called NSIP and State Elder Lunch that are other pieces to this nutrition program. But within this nutrition program, we're funding the Chinese Golden Age program and Ethos, who then funds a lot of partners, to do the community cafes and Meals on Wheels programs for Boston. And I will say there's a lot of other funding besides the funding that kind of flows through us. There's a lot of other funding that comes into Ethos and Chinese Golden Age for these programs that are through state and other healthcare partners. But within this Meals on Wheels program, there are a lot of different meal types, and I may have to ask Melissa, is it 8 meal types, Melissa? 8 different meal types?
Yes.
And do you have them right there?
So as Emily was saying, we have kosher meals, Caribbean meals, an Asian meal, Vietnamese, Italian, African American, vegetarian, then therapeutic meals, which can help with like cardiac appropriate diets or diabetic diets, and then just a traditional American meal as well.
And you
Chinese
can do
Golden Age.
also like pureed.
That would fall
Pureed.
into the therapeutic.
therapeutic
You can do
diets.
pureed meals as well.
If someone has swallowing challenges.
Yes, yeah, sounds good. Let's see, but touched on many of the things that you said about the Age Strong shuttle and going to grocery stores. We've had some inquiries about whether or not a shuttle could go from Brighton to Market
Basket. I knew you were going to say that.
I know, because I know when I go to Market Basket in Waltham, I see the Council for Ageing from Brookline is there, and all these other Council from Ageing are driving their elders to Waltham to Market Basket. I just don't know, is there any possibility we could explore that possibility? Because, you know, the reality is that folks cannot afford to buy food at Whole Foods or even Star Market, and Market Basket does really meet that need in a huge way. So anyway, it's just a thought. I said I would ask the question.
We can certainly try to explore that. We have tried to, when we're picking up for grocery rides, we have tried to kind of drive to the closest grocery store. But given that we have Market Baskets kind of not in the city, but like around, we've tried to make some exceptions for some Market Basket trips, so we can kind of look at what the distance would be and what the time would be and whether or not we'd be able to do that.
Yeah, because we literally have a food desert in parts of our neighbourhood. There isn't a supermarket that's affordable, that's in walking distance to many of our residents. And then the other question I had really was in terms of, you know, thinking about, I'm really delighted to hear about the Elder Behavioural Health Programme, and I know one issue that we've talked about this before in the past is just, you know, the issue of hoarding, and it becomes a health. You know, we get rodent and insect infestations, and people can't move safely through their homes because there's cluttered, and you know, it is a pretty serious mental health, behavioural health issue with elders. So where are we at on that one?
Yes. So I guess some exciting news on the hoarding front, because it is a really challenging problem, and we've been trying to figure out how we tackle it. We are finalizing a contract. I don't think it's final yet, so I'm not going to publicly say it, but I think we're finalizing a contract with a provider that's going to support a hoarding pilot over the next kind of 14 months or so. We're going to be partnering with other city departments, so the Mayor's Office of Housing, Inspectional Services, Fire Department, BHA, and BP, Boston Public Health Commission, and trying to figure out how we can work with this hoarding provider. The hoarding provider will be providing crisis case management and appropriate support for clean out. In the past, we've been able to help with some clean out, but we haven't had the behavioral health supports to pair with that really can keep somebody kind of from recluttering. And so I think we're going to be learning a ton over the next 14 months. We're paying for that with partially a city operating budget investment, a little bit of ARPA dollars that is coming from the Mayor's Office of Housing, and to round that out, probably some of our council on aging dollars in there. But excited to see what we learn and how we can create a program for the long term in Boston that will kind of need additional funds for long term, but looking to see what we learn over the next 14 months in that.
Mm-hmm. And the other issue really is we see an increasing number of elders who are housing insecure.
Yes.
You know, they've lived, maybe been long-term renters in a home, maybe a two-family home they've rented for 30 years, and then all of a sudden the owner of the building, it's a two-family perhaps, and the owners die or go into senior care, residential care themselves, and the house is up for sale, and then the elder who's lived there for 30 years is all of a sudden finding themselves needing. This is a huge issue, and I think it's like an iceberg. We just see the tip of the iceberg, and I think it's only going to get worse. Like how are we addressing that, or what work are we doing to prepare for making sure? I know there's great organisations like Elders Living at Home and whatever, but I just think how are we addressing that issue?
Yeah, it is a huge issue. For sure. We have a small team downstairs that's dedicated to housing support for people. So we have 5 positions, 4 of which are currently filled. And we are supporting people best we can with things like landlord-tenant mediation or help with housing. You know, we can do some limited help with housing applications, trying to help people kind of navigate the system. We work in partnership with the Mayor's Office of Housing, the Office of Housing Stability. We also, through these Title III-B funds, do fund a few partners to do that work. So you mentioned the Elders Living at Home program. We also fund ELAP to do that work, ESAC. So I don't know if folks know ESAC out of their, I think, main office now is in JP, but they do a lot of senior home repair work. They also do housing stability work for us, which is just so the work that they do and the ELAP does and that our team does and that the Mayor's Office of Housing does with their partners, so essential, but never enough capacity there to help people. We also do everything that we can around the prevention side of things. So helping people access other benefits programs. We do benefit screenings on people. Having the money to pay your rent and mortgage is really important. But tackling the rent and mortgage is not the only way to help free up money for rent and mortgage, right? So we want to help people with their health insurance, with accessing fuel costs, with food, kind of any other benefits we can help them with to bring more money into the household to help free up a little bit of more money for kind of the rent and mortgage piece. And then we will have coming before you in the upcoming weeks, we have the property tax work-off program, which we're really excited about. Right now, you can work off up to $1,500 of your property taxes by volunteering in a city department. We'll have coming before you in a couple of weeks the opportunity to expand that up to $2,000. So I think that's one of the ways that we're trying to get at, I feel like it's going to be lots of different things that help us stabilize folks here in Boston. All the work that the Mayor's Office of Housing is doing, not just the Office of Housing Stability, but the work around kind of developing more units is critical, and somehow it all pieces together.
And I know I'm taking a lot of time, but the work-off program, I think one issue for us out in Alston Brighton is it's a long way. Like if you have to travel on public transit to go to work off, a job, whatever, that sometimes you've got a window. You go for 3 hours, and it just takes you an hour and a half each way going somewhere. Is there an inventory of sort of the jobs that are available in each neighbourhood, locally accessible jobs, so that folks don't have to, given the state of our public transit system right now?
For sure. So I don't know that we have an inventory, although we can create one, but I think the process that we typically follow is that we talk to the person that applies. We kind of understand what their interests are and what they want to do and where they want to be. And then we work with city departments that are kind of in that area. So the state statute prevents us from placing people in places that are not city departments. We can't place people in kind of nonprofits in neighborhoods, but we work closely. Like we've had work-off volunteers at our senior center, at Veronica B. Smith. In Brighton, we also work with the local community centers and libraries to see if we can place people kind of out in where they want to be doing what they want to do.
Okay, good. I thank you. I've
Thank
taken
you.
a lot of
That's
time.
fine. Thank you.
Thank you.
You're passionate. Thank you. In that list, I was just thinking maybe even a partnership with our schools would be.
I'm sorry, we place people in
No, you
schools
probably
as
do.
well.
Yeah,
Yes.
'cause I know seniors have come and
Yes.
they read to the students. Just one quick thing before I pass it off to Council Fitzgerald. Thank you for mentioning the partnership with the police. I go to the Chinatown safety meeting, and yesterday Captain Martin was talking about some community meetings coming up soon for the neighborhood to talk about scams and how they can, protect themselves. So
Great.
that is great to hear. So Council Fitzgerald?
Thank you, Chair. And thank you very much for all your answers so far. Just a couple of quick questions. The best part of this job so far for me has been the education that I've received, right, in talking to all of you. But so I do sometimes have questions that might seem pretty mundane, but it's all for my edification. Title III, I see everything comes from Title III at the federal level. Could you just give me a brief description of what Title III is, because I'm unfamiliar with it?
Sure. Welcome to the council,
Thank you.
Councilor. So Title III is a section of the Older Americans Act. So at the federal level, there's an Older Americans Act that helps to guide kind of the framework for aging services in the United States. And a piece of that, Title III, is the funding that requests that you see before you. So that is money that goes out across the country to area agencies on aging to provide a set of services. And so Title IIIA is administration, B is support services, and this is where we get to assess what local needs are and kind of have a little more flexibility in our funding, although we have this like list of categories we can fund in, so it's pretty driven by the feds. Title IIIC is nutrition services, which funds what we call in Boston community cafes, but it's like congregate meal sites, free congregate meal sites for older adults. They just have to do a $2 donation. And also the Meals on Wheels, a portion of the Meals on Wheels funding. Title IIID is health promotion and prevention, which funds evidence-based healthy aging programs. Title IIIE is caregiver services, so we fund the family caregiver, it's called the Family Caregiver Program, so we fund a caregiver solutions program at Boston Senior Home Care for that. And then also a grandparents raising grandchildren program through MSPCC. And then there's the ombudsman program, which is the long-term care ombudsman. So that is funding for ombuds that sit at local nursing homes and help to handle any challenges between kind of the residents and families and the nursing home administrators, and they help to kind of navigate and help with communication and things like that.
Great, thank you for that overview. I know we talked about shuttle drivers and transportation, always thinking about city jobs, what we have. How many of those, you said there's about 21 drivers. Is that out of how many, or is that 21 that what's the ideal number of drivers you would have if you could?
Yeah, so right now we have 21 funded driver positions. We probably have 18 drivers. I think we're in the process of hiring one, and we had a couple of retirements.
Yep.
So we're in the process of hiring for those positions. I mean, I think where our focus is right now is trying to see, we got some new scheduling software just before the pandemic. And so, and we just had an assistant director and a new dispatcher started our shuttle. So we are excited to kind of get fully staffed there. Then to look at our how we optimize our scheduling software in the best way possible. And then to really create a plan for how we expand shuttle services. And I think I mentioned earlier, I don't know if you were in the room, but we really want to see if we can leverage additional healthcare dollars with all the rides that we're doing to hospitals. If there's a way for us to leverage additional external dollars, either through kind of the state like Medicaid rides or hospital partnerships, because we do reduce healthcare costs by making sure folks get to their appointments. And so we're looking forward to exploring that once we're fully staffed, and trying to see how we can do like an overall transportation plan to make sure that older people in the city can kind of get where they want to go when they want to get there.
Yep, that's great. Thank you. I just want to also echo what my colleagues, Council Braden and Council Flynn, talked about in the consumer protection. It's certainly they can prey on those that are older, but I think it's more of an issue now nationwide. I mean, for all ages, right? And with the introduction of AI, I think it was Ed or I'm sorry, Council Flynn or Council Braden who asked, what are we doing to promote sort of this thing? And I think it's such an evolving thing right now. It's almost hard because whatever you teach them today, it could be different in a couple of months with voice recognition, that all the things that they can do. So hopefully we can get our arms around that. But certainly, just want to echo that sentiment again. Finally, what events or programs do you all think at the Age Strong Commission, if money was not an option, which one would you grow? Like I guess what I'm asking is which program and events do seniors enjoy the best, where if you had to focus on, you get your best return on investment?
Definitely the dancing ones.
Is anything with dancing, food? We could put dancing and food down, right? Check those, but.
So I mean, I think, and I should just mention, since we are talking about grants, we do fund a lot of programming through our Title IIIB, which I don't think I mentioned before. We fund 10 nonprofits to run kind of ongoing senior programs. And so we couldn't do what we do without these dollars. I mean, there's 120,000 older residents in Boston, so everything could probably be increased. But Melissa was just saying before we started that at our senior center in Brighton, they do programs every day, and they have a whole group of people that are coming in every day. Sometimes they do these trips, and they have a whole different set of people that are coming on the trips. The way I think about engagement for older adults is people who are over the age of 60. First of all, it's like 3 generations, right? Secondly, they speak many different languages, come from many different backgrounds, and have many different interests. Older folks are just as diverse as younger folks, just a little older. And so I think you need to offer something for everybody. And that's really what we're working towards, is how do you offer things that people are passionate about? Some people want to go to a large party and do some line dances. Other people want to hear a lecture. Other people might want to do a lifelong learning program. And other people want to go on a trip. Some people want to do all of it, but not everybody. And so how do we take the spaces that we have and the resources that we have and figure out how we kind of meet the needs of what is a very, very diverse older population?
Thank you. Yeah, I know it's kind of an open-ended question, but I'm just thinking in terms with budget season coming up and where Title III can fund administrative and food and other things like that, and caregiver support, where would we want to focus our budget to support all the other things that you guys do? And that's why I sort of just asked, what's the best ROI that you guys seem to feel that is out there? But I know it varies a lot from individual to individual.
Yeah, and I would say the 2 areas that we're really looking over the long term. Well, actually, there's a lot of stuff we want to do over the long term. But as we think over the long term, we've brought on this consultant now to think about kind of senior programming and spaces and how we can increase that across Boston. The other piece that I think combines with that is once you're getting people to spaces, they come with a whole set of things they need help on. So we're also looking to kind of expand the amount of support that we can give people that are coming for programming, support around connection to other resources, access to benefits, housing support. So looking to see, not only do we want to have older adults coming to additional programs across the city, we want to be able to support them with all the needs they bring to those programs.
Thank you, Commissioner. Thank you, Chair. No further
Thank
questions.
you. I do know the Vine Street fishing trip, that bus is always full. There's some great opportunities out there.
Yeah, and I would just say we appreciate our BCYF partners. They're doing a bunch of senior programming out there, and that's one of the
awesome.
programs they run.
Thank you. We have been joined by President Louijean.
Hi. Good morning, everyone, and thank you, Commissioner Shea. Thank you to everyone. You have a great team at Age Strong, and just the work at the Black History Month celebration was incredible. The dancing, yes, the camaraderie, and just how needed the space it was. I don't have any questions on these yearly grants. I think the work that they're important. They fund work that we think is important when it comes to our older adults, when it comes to hoarding, when it comes to issues. We get a lot of issues in our office. We all do as counselors when it comes to our residents tenants who are facing, older residents who are facing issues, either renting or owning. And so just thank you for your partnership, and anything that gives you money towards that is important. I don't even really have a question, because we talked yesterday about some of the issues that I've been hearing, sort of especially as an at-large city councilor, and elevating some of the needs that some of our seniors have been uplifting, especially when it comes to more engagement, more senior activities. So I think those questions I'm going to reserve really for budget. I think that it's phenomenal, the grant, up for the $500,000 grant that Age Strong has for our neighborhoods. Love to hear that the exemption is going from $1,500 to $2,000 for property taxes for those engaged in community service. So I think that's great. I know that we're also going to have a hearing on ARPA, and my advocacy to put a set aside for money for senior programming. I want to see us do more of that, and I want to see more of that in the budget, especially because we hear so much about it from our residents. We talked about residents in West Roxbury, Hyde Park, and Rosendale yesterday, but you also mentioned, and they've come to our office, residents in Roxbury, and making sure that we are uplifting the needs of our Black and brown adults. So thank you for the work that you do. I think those are more questions that we're going to have, I'm going to have during budget and as we review our COVID money to make sure that we're continuing to spend that money to uplift the things that we hear about every day from our constituents, which is I think what Councilor Fitzgerald was asking about, senior programming and senior engagement. I think the pandemic taught us a lot, and it taught us a lot especially about our older adults and the problems with isolation, and if we're not being intentional about creating space for our older adults. So thank you.
Thank you.
Thank you. One thought I had, thank you, Councilor Braden, for lifting up the hoarding issue. Something we might be able to look into is the storage we provided for the tent encampment on Atkins Street. We can maybe talk about that offline, but definitely something we need to address. Do any of my councilors have any other questions? Do you have any other questions, Councilor Braden? Yes.
Counselor, I realize I didn't address the universal grant, so maybe I can just say
Yes, please,
2 words about
yeah.
that since that's not a Title III grant.
Okay.
So we have kind of ongoing sponsorships for some of our events by some partners out there, and worked with, instead of coming back to you all the time, worked with our auditing department to set up this universal fund that would allow us to take in small donations. The larger ones, we would come back to it for an accept and expend, and this would be like an overall accept and expend for the smaller ones. So
That's great, thank you. And thank you, team, for being here. I know that your office is always open, so I know my colleagues will be reaching out, and we're here to support you during the budget season. So please make sure you reach out to myself or anyone on the council. So with that, dockets 0376, 0379, 0380, 0382, 0383, 0384, and 0386 is adjourned. Thank you.